Hello, students. Good day. Today, I want us to go through how to successfully complete the clinical schedule book, or what we call the field practice schedule book for registered general nursing. And as you can see, this is a sample of it, and that's how the front page looks. So now we're going into it to see how things are and then how it looks. First of all, you are supposed to make sure you meet some required number of hours. As a student, registered general nursing student, you are supposed to meet some number of hours where you would have to consider the fact that if it is not met, the process will not also be met, and NMC will not consider you qualified to be a student and to be able to sit for the licensing exam. So by this, now when you open to the next page, you realize this is how it looks, which demands that you should complete this part as a student before you start your clinical experience. You will need to indicate your name, and for this I would advise that you write your name in block letters or capital letters. That is how the name is supposed to be arranged. Then you get the name of the institution, you also write that one there for you. And when you go in there, when you are done, then we now go into the various practice areas that you are supposed to do as a student. So without wasting much time, we'll be going into the various practice areas that we are supposed to tackle. But with this, I have just picked some samples of the various areas within the entire clinical schedule book. It's supposed to last for the entire 3 years as an RGN student. So each year, the courses you have gone through and whatever process that you have done, those are the things that you are supposed to make sure you cover. So it doesn't mean that you just have to do them in one time clinical session. So with this is the first session you are going to go through, and then this is how it looks. I'm trying to zoom the page so that you see how things are, and this is the clear picture of it for the first page. You would have it as basic nursing, and then into bracket the nursing process approach. So to my left here, you would realize those are the clinical experience areas that you are expected to meet as a student. And then the next column after it, you will see column 1, column 2, column 3. The column 1 comprises of the classroom teaching. That is what your various tutors will be taking you through. So within the period of basic nursing, whatever that you have been taught, which is found in the first column here, that is the areas for clinical experience. Each column, whatever that you see there, it has its corresponding date. So you indicate the date as a student, then it will be given to the tutor to also sign as a tutor that have taken you through those particular areas. Then you as a student, you equally do the same thing. So you realize it starts from assessment, then it goes on and on and on. Each of the pages you would find basic nursing approach there, where you would have to go through all the areas that you are supposed to tackle. This one is for classroom approach. So, but with students level, usually they want to keep the whole thing, then they will write all the dates and then it will be uniform, then they will sign and submit them to the tutor to do that. It is accepted, but some institutions will definitely want, it depends on whatever the tutor wants. So the tutor will decide that after each class, that group will bring them and then he or she will sign. Any of them is accepted. Now let's go to that of the column 2, which comprises of the demonstration room or clinical skills acquisition laboratory. Now let's take note of this. Every school is supposed to have a demonstration room, and then in some situations where the clinical skills acquisition laboratory is also located in the clinical setting, that is the hospitals, you would have to also consider it as such. So in situations where the tutor takes the students through practical session in the skills lab, and if any of these ones under the experience areas, that is in the first column to the left here, if any of them is done in the skills lab, then the dates to which those areas were taught, that is in the skills lab, those dates will be indicated. Then the tutor will sign, and then the student nurse also signs. Bear in mind, you, the student, will write the dates, then you will sign before you send them to the tutor or the clinician to sign. That is how it goes. But in case there is any other one, just like what is here, and you know that one is also the same thing as the basic nursing, it goes on and on. It has about 12 pages. So if at a particular time a tutor is not able to take you through, let's say, identifying health problems and strength of patients under the planning of patients and family, if that particular one is not done, and then you experience it as a student in the clinical setting, that is when you go for clinical attachment, and that one was taught, that is a demonstration. If it has been demonstrated to you, you are at liberty to also write that particular date. Then you will sign as a student, and then the clinician who taught you at that time will sign for it. But usually in most of the schools, because we take you through the demonstration process, we most of the time sign for all these things in column 2. So you see the tutor's signature there, and then also in column 2 for the demonstration. But it also means that as a student, if a particular one is not assessed or is not taught in the skills lab for the school, and then you experience it in the clinical setting, you are at liberty to also write the dates covering all those ones that you were taught. Then you sign, and then you also give it to your clinician to also sign. Now let's go to that of the third column. And the third column involves the ward or the field competency. When we say competency, it means that what you are able to do. And when you do it, you should have every conviction or every ability to do it, even without supervision or without any help. That is what we mean by competency. So in this section, students, I want you to consider the fact that so far as you are a student and you go to the ward, this one is practically for the ward. Column 3 is for the ward when you go for clinical attachment. When you go to the ward, and let's say your instructors tell you to make a bed. If you go to make the bed, the first time they come to supervise you to make the bed, and if it is okay, they tell you it is okay. If there are any 1 or 2 corrections to make, they tell you to make those corrections. At that time, that particular day, do not sign for this side, but you wait and do it again. It doesn't mean a patient should come for you to do it, or they should instruct you. But when you realize there is a free period, it could be that same day, but after the time that you were supervised, at a free time, you can seek permission from your seniors or the ward in charge, go to do that same thing you were asked to do under supervision. Then this time they will not comment, but they look at it, and when you are able to do it and do it well, then you write that particular date, then you sign, and then the clinician also signs. So bear in mind, this whole clinical schedule book, you are supposed to sign more than 80% of it through your 3 years of study. So it means that it will include the classroom, that's column 1, column 2, the demonstration, and that of column 3, the ward or field competency. All of them that you would sign will take you up to a minimum of 80% fully signed. Now very soon, this is all what I need to tell you about basic nursing, and the trend will have to follow for the rest of the various practice areas you are supposed to go through. So this is what I have, and then in short time we'll also be going into the next experience that we have to, which is also a different one, but it follows the same principle. Okay. Yes, now this is the next session that we need to see, and this is the page where basic nursing ends. So from that particular page that we have looked at to this particular page, you would have a whole lot of things that you are supposed to go through as a student. And if you look at it, we have last offices, we have supporting patients and relatives, you have ability to evaluate care, you have ensuring physical comfort. All these things, you realize we do them in the ward. So just as I mentioned, the tutor takes you through, and that particular date that the tutor takes you through, the dates will be written. Then you as a student, you sign, then you give it to the tutor to also sign. Now in column 2, just as I mentioned, it has to be a demonstration. So the tutor demonstrates for you, and the date where the tutor demonstrates any of these, it shouldn't be all of them, but it could be a particular one or a number of them. So which ones that the tutor has demonstrated or the clinician has demonstrated, be it in the skills lab or the ward, then you write that particular date, you sign as a student, then the clinician or the tutor also signs. And the same thing applies to the competency. And at that time, you should be able to sign that this particular one, let's say discharge of patient. You come here and let's say today's date being the 25th of January 2025, I have been able to perform discharge of patient without any problem, and I can do it and do it very well. So I'll indicate today's date here, then I'll make sure I sign as a student, then I give it to the clinician, the ward in charge, or any of the senior colleagues who was there to supervise you do that particular thing. That particular person will also sign here, and that one completes the competency. Bear in mind, the competency indicates how prepared you are as a student to sit for the licensing exam, right? And if you successfully pass, then you will be enrolled as a nurse. So let's make sure that we concentrate more on the field competency, just as we have to do for the skills acquisition and then that of the classroom. Everything is very important, and then it has to be considered. Now let's go to the next one, which is first aid. And you can see it, first aid follows basic nursing. So every other topic or every other application area that you have learnt in class, which are all outlined here, under first aid you'll be taught bandaging, the various types of bandages, and then how bandaging is done, arresting hemorrhage, managing special hemorrhages, and the likes. All these ones will be taught in classroom. So the dates that you were taught as a student, all those dates will be indicated within it, and as I mentioned, they will be written the days that these particular ones individually were taught. Sometimes we cover all of them in a particular day, so a date can be written across, and then that is it. But if some were taught in a particular day, you write for those ones, and then the rest that were taught in another day, you also write the date for it. Then the tutor will sign as well, as I mentioned. You, the student, also make sure you sign. Then the same thing applies to the demonstration or the skills acquisition laboratory. And in this case, you might even get to a third year in some of these, and you would not experience, or you will not have a field experience for, let's say, application of roller bandage. This might be because of where you find yourself and doing your practicals. But it doesn't matter. As a student, you need to always find a way of learning, and that is how come it is demonstration. So even if your attachment, your clinical attachment area is not suitable enough for you to see some of these things, but ensure that you question the tutors, you approach the tutors so that they'll be able to help you and take you through some of these things, and then you'll be able to completely sign it. Then we do the same thing for that of the field or ward competency. It has to also be signed, and this one you have to go through that. And when you go through each of the process, let's say an example like sling, application of a sling. So if you are in the emergency ward, accident and emergency ward, and then a patient is brought, rushed in, and then you are supposed to apply a sling. So as they do and you observe, then the next time you also try to assist them to do, and when you assist them to do that particular thing, they have demonstrated it for you to see. So that particular date, you would write the dates here, then you will sign as a student, and then the clinician also signs. So the same thing applies to, let's say, management of special areas like epistaxis, and we all know what epistaxis is. So you might be taught in the class, then the tutor will sign, then you, the student, will sign, but it will take in a month, 2, 3, or some time later that you will get the experience of epistaxis, managing patient with epistaxis. Remember, in the skills acquisition lab or the demonstration room, you might not get the physical aspect of a patient going through epistaxis. So sometimes we tutors find it a bit difficult to explain some of these things or to demonstrate it. So we teach you in the classroom, but when you get to the ward and then you experience that again in children's ward, in the accident and emergency ward, you can get some of these ones, and when they demonstrate that one to you, you also write the dates, then you sign and make sure the clinician signs. If it is the tutor that demonstrated it for you, you make sure the tutor also signs. Then if you comfortably do it in column 3, if you comfortably do that which comes under the competency, you also make sure you sign. But it is not a must that you should sign everything that is on the experience areas as competency. At least we know we are human beings, and it's not everything that you have that experience of doing. And that is why when you start your nursing as a qualified nurse, then you have to go through that process gradually. And as you grow in the profession, you get to learn some of these things. But it is expected of you to cover 80% of these ones that are outlined here, so that you can comfortably be called a nurse. So that is what we have for first aid, and then we'll be going in to also see the next one that we have in short time. So yes, this is what we also have here, and that's the continuation for first aid. So you realize that we have bleeding from the tooth sockets. We also have hemoptysis. We have various ones that are hematuria. We have bleeding per vaginum, a whole lot of them that are also outlined here. So the same way you go through it, and this is under the classroom teaching, you would make sure that if you are taught, those ones that you are taught, you write the dates for them, you will sign as a student, then you make sure your tutor signs. Then if these ones that have been outlined under the areas for experience, if those ones have also been demonstrated to you in the skills lab for the school, you make sure you do the same thing. You write the dates that you went through the demonstration, the tutor signs, then you, the student, will also sign. And if it is also demonstrated to you in the ward, just as I mentioned earlier, you would have to also make sure that particular date is signed, and then you sign for it. Then the clinician also indicates his or her signature to make it valid. This same thing also applies to that of the column 3, which is the ward and field competency, just as I mentioned. So those ones that you have been able to tackle or undertake comfortably with your team as a student that you go to join the nursing team, if you are able to do those ones, let's say bleeding from the tooth socket, what were you taught in the skills lab to do? If it is from the tooth socket, maybe your tutor will tell you that you have to add some padding. Then you make sure that the patient bites on that padding. So you put something to pad the socket, then you bite and apply pressure so that it will be able to stop the bleeding. So if that is what you were taught in the demonstration room, then you sign. But when it comes to the ward, is that actually the one that is done? So if it is done like that, did you do it yourself? If you did it yourself and that worked just as you were taught in the skills acquisition lab, then you write that particular date, you sign as a student, then the clinician also signs. So it means that this book, every day that you go for clinicals or every day you go to the school classroom, you need to carry this book, or you have your pocket notebook so that you can be indicating some of these things and the dates you were taught. And then when you finish with it, you can now sit and look at it. The same thing applies to managing unconscious casualties like fainting, convulsion, which is very common in children. You also have fits and epilepsy, also common in children, but adults can also go through that. All these ones, adults can go through it. We have coma, and then we have diabetes. Some of us know diabetes. So if you are taught diabetes, everything about diabetes in class, you do that. Then if it is demonstrated to you either in the skills lab or in the ward, you also do as I mentioned. The date, you, the student, will sign, then the clinician signs. Then you move on to the competency. But if you have not experienced that within your entire training, it is not a must for you to do it, but make sure you also ask questions as you go for clinicals so that you'll be able to get that. Now we go to the next one, which is also under first aid, and it's the same thing. All these ones that are outlined here, let's say sprains and strains, we have dislocations, we have fracture. What type of fracture it is, at least when you experience it, you will be taught in class. And then when you go through the demonstrations, then you write the dates, the tutor or the clinician signs, depending on whoever that demonstrated to you. And then you also do it if you have been given the opportunity to try your competency. Then you also write the dates, you sign, and the clinician also signs. All right, so that is what we have for first aid, emergency, and disaster nursing. So very soon we'll be going into the other ones that follows, and as we go on, I might be moving a bit faster because it's the same experience, the same idea, but it's just different in the areas that we are supposed to capture. So we'll be looking at that very soon. All right, so the next after first aid is advanced nursing. And as you graduate in the nursing school, you start from basic, then you are advancing yourself and you'll be going further and further. So as the training goes on, you'll be experiencing subjects that are under advanced nursing. In this, it has been compressed into advanced nursing, but some portions will include surgical nursing, some will include medical nursing, and then some will also include the advanced form of basic nursing. So all these ones have been boxed for the RGN students, and this is what we see. So when you look here, you would see that care of wounds. So directly this one tells you that it is under surgical nursing procedures. Though the basic nursing, you can also have some experience like that, because we are also supposed to teach you these ones. So if you are taught by the basic nursing tutor, let's say cleaning of a wound, that's a clean, determining which type of wound, clean wound, contaminated wound, open wound, closed wound, surgical wounds, and the likes. All these ones you will be taught in school. And just as I said, the dates that you were taught all these ones, you write the dates for it, you sign as a student, then the tutor also signs. Then you apply the same principle to the demonstration, either in the skills lab or in the hospital setting, if there is a clinician to demonstrate for you, in case the tutor fails to demonstrate for you. So just as I mentioned earlier, any of these experience areas, if you have been demonstrated to in the skills lab or in the ward, you write the date that corresponds to which of them, then you sign as a student, and then the clinician also signs. Bear in mind, if it is only one aspect that you were taught under demonstration, just locate that single one, write the date to it, sign, and then make sure the clinician or the tutor signs for that particular one. But it is obvious that you will not be taught a single one. We usually cover quite a number of them because they link up and we get all of them through. You start from here and you would have to go through the next one. So that is what we also have. And the same principle also applies to that of the competency. Just as I mentioned, if you now understand it, you have been demonstrating and you are okay with the demonstration and you can now do it comfortably, you do that particular one, then you make sure you write its dates, you sign, and then the clinician signs. So this competency actually is for clinicians alone, just as column 1 is also for tutors alone. But for column 2, it is usually for both tutors and clinician. Any of us can sign for that, okay? So that is what we have. And then it goes on and on. You can get wound irrigation, you can get removal of sutures, you can get removal of clips, and all those things. You have wound debridement. All these processes, you would see them, and basically you'll be visiting them under basic nursing, that is in the classroom, and you equally see them under surgical nursing. So depending on which tutor that takes you through, then you make sure the tutor signs for it. Sometimes we tutors also communicate. If the surgical nursing tutor will be doing those ones, we leave that aspect for the demonstration for the surgical nursing tutor to come and demonstrate. So in some situations you might find different tutors who will be appending their signatures for you, and then you apply the same thing for the competency if you have had the competency of doing it. And then the very last one on this page, which is the education of patient or counseling. And as a nurse, we're supposed to educate patients, or we counsel them. You can educate them on their disease conditions, and we have a whole lot of education processes. So we can also counsel them. Patients might come, they wouldn't even have enough knowledge, and some conditions or some of their states will also be there that you need to take them through counseling in order for them to understand the process. So that is what you do. And if you are able to do that and you do it very well, then you can sign for that of the competency. And I want to urge students to always try and do that, because the more you try to teach someone, the more you build more knowledge, and then you'll be able to go on. So this is what we have for advanced nursing, and then it goes on to the next page, which is also for advanced nursing. Bear in mind, I mentioned earlier on that I just picked samples of each of these ones. So you'll be finding some of them 1 page, 2 pages, but it doesn't mean that is how it ends. There are quite a lot of them, so you follow the same principle and you'll be able to get through it. So this one is the same thing. We have informed consent. So in the classroom, they'll teach you what informed consent is, how to get it, how it is done, and all those things. So if you are taught, you write the date for it. Then in the skills acquisition laboratory, the same thing. You now practicalize what you were taught in the classroom, and if you do it, you also write the date for it. You sign as a student, the clinician signs. And if you are lucky to have an experience of it in the ward, you also do that. If you haven't gotten the experience, don't wait to always get it. You can even ask your nurses when you are a bit free in the ward, oh, how do we generate informed consent for a particular patient? How is it done in the ward here? Then they will teach you, and when next you have the experience on a patient, then you do it, and then you write the date, then you sign, and then the clinician also does the same thing. So it goes and runs through on and on and on. We know transfusion of blood is a usual thing that nurses go through. Patients also go through that. So you can imagine, we'll teach you transfusion of blood in the classroom. You might be lucky you will get a demonstration of it, depending on the setting of the school or the arrangement of the tutor. But if you don't get that and you get to the hospital for clinical attachment, and whenever your seniors or the in charge is going through such a process, you go to observe, and as you observe it, you can write that particular date, you sign, and then the clinician will sign, and that one will cover for the demonstration. Then you make sure the next one that comes, it shouldn't be the immediate one, but at least you should observe for some time. Then you build the trust that, oh, I can try. And when you start to try, and then you build your competency, the day that you build the competency and you do it with every competence, then you'll be able to write that particular date, you sign, and then the clinician also signs. So that is how it follows, and then you'll be able to complete it. And as I mentioned, bear in mind, you always make sure you carry your shorthand notebook, or you carry this same book. Handle it very well, make sure it doesn't become dirty, then you handle it. And when you go to the ward, anytime you experience some of these, then you quickly write the date. When you are less busy, you write the date, then you come and tell the clinician, oh, can you sign for me? I observed this and you did for me. Then the clinician will sign. And when you are lucky to get the experience to test your competency, you also do that. So it goes on and on. You can get intravenous infusions here, which also have them lined. So in this, that is how it's going to go. And then we are going to see the next one in the next page. Now, yes, students, back again. This is the next page after advanced nursing, and you would see, as it is written here, section D, that is pediatric nursing. So under pediatric nursing, just as I mentioned, in the classroom, you will be taught all these experience areas in the classroom. So the dates that you were taught all these things, any of these things, as I mentioned earlier, some tutors will teach you almost A to F in one day. So if you are taught in one day, you write the date across, then you sign across, and then the tutor also signs. Then if you are lucky to also organize, and the tutor to organize a demonstration session, and then is able to do this for you, you write the date, then you sign as a student nurse, then the tutor also signs. But if the tutor is not able to do it and you experience it in the ward, you do as such, then you do the same thing for the competency. Now let's take an example of taking history or history taking. For instance, you will be taught in the classroom, you would have demonstration, but when you get to the ward, you take history. At least those that will be in the ward, the OPD, the nurse's desk, you know, they take history, patients complain and the like. Some facilities, they spread the nurses in the consulting rooms, and they take various history before they see the doctors for consultation. So in taking history, for instance, if you have gone through demonstration and then you have observed and you trust you can do it, you try your hands on them, the time that you can do it comfortably, then you let your in charge sign for you when you have signed and written the date for it. So it applies to all these ones: admission of a patient, observation of a patient, weighing a patient, changing a patient. So you change the patient's clothing. You know, in admission we change the patient's clothing to a pajamas or a more lighter or a suitable dress for admission. So we do that, and that is helping the patient to change. If you have the demonstration, then you also do for that of the competency. Now the next one is feeding a child. You go through all these things. Some mothers will breastfeed, and others, the children will also be weaned, but still they will put them under pediatrics. So if it is like that, observation or supervision of breastfeeding, you supervise the mother, and remember, you'll be taught in the class, so demonstration will be done, and then you have the opportunity to test your competency after several observations or demonstrations. And the same thing applies to preparation and supervision of artificial feeding. then it goes to nasogastric feeding, then it comes to intragastric feeding. So that is how it goes and goes and goes. You have infants with feeding problems like cleft lip and then cleft palate. So all these ones, if they are taught in the classroom, you indicate. Then if you had experience for them, demonstration, you also indicate the date, you sign, the clinician or the tutor signs. Then the competency, if you also had it, you do the same. So that is how it is under pediatric nursing. We'll be looking at another one under pediatric nursing, and then to close that chapter, so that we'll move on the next one. Okay. Yes, now this is for pediatric nursing, and just as you can see, we have some experience again that are outlined here, which also include taking history of children, admission of children, observation, weighing, protection from injury, bathing, and all the likes. We also have some special areas like Oshako. You can see it. There are other conditions that if you also goes through it, you see it. So all these ones, if you are taught in the classroom, just as I mentioned, you write the dates for the class, and then you sign as a student, then you make sure your tutor signs. And if you have been able to go through demonstration, that is if the tutor or a clinician is able to demonstrate for you, which is also a must, that you should at least have that experience of going through demonstration. So the dates that the demonstration was done, you indicate that particular date for each of them, which of them that was demonstrated to you, then you sign, and then the clinician or the tutor signs. Then, just as I mentioned, under competency, you would have to also do the same thing. You specify which date it is, you sign as a student, then the clinician signs. So this is what we have under pediatrics, and then it is going to go on for us to see how the next ones also entails. Now, this is another sample for pediatric nursing, and this is how it also follows. So you realize we have asthma here, we have bronchitis here, we have bronchopneumonia, we have coryza, we have lobar pneumonia, and the likes. All of these, if they are also taught in the classroom, you indicate the dates for the classroom teaching, you sign as a student, then the tutor also signs. And the same way with the skills acquisition or demonstration, either the skills lab or that of the hospital setting, the dates that all these things were demonstrated to you, you write the date, then you sign as a student, and then the clinician also signs. That is how it is. So a point of reminder again, if you were taught more than one in a particular day, you can write the date across. Then you as a student will also sign across, and then the clinician or the tutor signs across. But if it is just a particular one, let's say one or two, let's say asthma was taught, and then bronchiolitis was skipped, and probably bronchitis and bronchopneumonia were taught. So you write the dates. If they were taught today, for example, you write today's date and for asthma, then you write bronchitis and then bronchopneumonia, so that you skip the next one and make sure you sign those ones, and then the clinician does it. Then you go through the same process for that of the competency. And as I mentioned, make sure the competency is always done, because that is what tells us how prepared you are for your licensing exam. And to even sit for the licensing exam, you can be processed, but when the officers come and look through it, they cross-check the clinical schedule book, and you have not signed enough competency to attain the 80% and over, you will be made to return, go and prepare, and then you sit for the next exam, which could be next year, or if the Nursing and Midwifery Council settles an exam again. So it is very important you make sure you sign all these ones. So we'll be looking at the next one in a jiffy.
How many more to go?
No, I'll be able to. I'm a hanger, jump around. Okay, so you can see the next one, which is perioperative nursing or theater nursing. So under theater nursing or perioperative nursing, in the classroom, surgical nursing, they will be teaching you all these. And you realize that they would have to, you will be taking through some of these ones, maintaining asepsis, and then preparation and sterilization of these items that are outlined here, abdominal packs, abdominal sheets. So all these ones that will be taught in the classroom, you write the corresponding date for it. Then you make sure you sign as a student, just as I mentioned earlier. Then the tutor also signs. And if you experience demonstration in the skills lab, just as it was mentioned, you also make sure the dates that you went through the demonstration, you write the date there under the demonstration column. Then you sign as a nursing student, and the clinician or the tutor who demonstrated for you also signs. Then when you finish and you have the experience in the ward, you make sure you also try to create that experience. Sometimes students will always want to outsmart the system, so they will not want to create the experience. They will look at this. How am I going to prepare dressing towels? How am I going to prepare dressings? How am I going to prepare cotton wool rolls and the likes? So they find it difficult and say, oh, this one, I will not do it. So they don't want to sign. But at least, if any of these come together, you are able to make up your points, and then you'll be able to sit for your licensing exam. So that is what we have here, and you do the same thing. So let's say an example, cotton wool rolls and balls. Just preparing cotton wool rolls and balls. That's one. You can easily sign competency for it, and you are gone. Preparation for sterilization. If you prepare any of these abdominal packs, abdominal sheets, shuttle forceps, all these ones, when you prepare them and then you send them for sterilization, you can easily sign for their competency, and that is how it goes. So we'll be looking at the next one, which you see it, which is also under perioperative nursing. We have these ones, care and storage of surgical supplies. You have the sutures, you have the suturing needle, you have the surgical instruments, the shuttle forceps, and other ones that they use for surgery. You'll be taught all these things in the classroom. So just as it is, the day that you were taught in classroom, you write that particular date, you sign as a student, then the tutor also signs. Then if you have demonstration, you write the date for the demonstration, you also make sure you sign, and then the clinician or the tutor signs. Then competency, you try as much as possible that each of them here, you try to have an experience of it, depending on the one that you will meet at your clinical setting, or the one that your in charges or seniors will also teach you and make sure you are able to do it. When they teach you well, and then it is under any of these, you write the date, you sign, and then the clinician also signs. So the same thing applies to all these, and then we go. You can see oxygen masks, that is airway. You can see a whole lot of things that are also lined here. You have the catheter, any type of catheterization, you can also go through that. We have the suctioning tube, which we use to suction patients on all that. So all these ones you'll be taught, and if you have the experience for it, you also go through that. So I want us to move to the next one, and we'll move faster. Okay. Okay, so the next one, on a quick one, is still the same perioperative nursing or theater nursing, and these are some of the areas that you are supposed to go through as experience. So if you are taught in the classroom, you write the dates to which you were taught, then you sign as a student, then the tutor signs. Then if you have been demonstrated to in the skills lab or even in the hospital, you also write that particular date each of them were demonstrated to you, you sign as a student, then the clinician also signs. Then the same thing applies to the competency. Maybe these ones, usually it is not about you doing the procedure. An example like mastectomy and then thyroidectomy. You realize you are not a surgeon to do that. You are not also a theater nurse to be the one, or any of these people that do, but you will be part of the team for that process or that procedure. So if you are part of that team, definitely some students in some facilities, you are so good enough that your in charges would want you to be part of it, so they'll tell you to scrap for this procedure. So if you scrap and then you are able to be part of that team to go for that procedure, quickly when you are done, you write the dates, then you will sign and let the clinician also sign for you. At least you took part of that procedure. That is, you were in the theater room for that procedure. That is what applies to these ones that are a bit special, because students, you will not be allowed to invade like that unless you have also gone through that training. But with all of these, if you are able to assist the team to do something and then you have knowledge about how it is done, then you can use that to sign the competency area. And just as I mentioned, the date that you were taught that particular thing and then you assisted in doing it. And if you trust that you have enough knowledge and if you are given the opportunity, at least you will know how to maneuver through. Then you sign for that particular day. You indicate the date, you sign, and then the clinician will also sign. So that is how it goes. And then we now just jump into the next one, which is gynecological nursing. And with gynecological nursing, it involves women. And you know they are all special for us. So that is how it also looks. Under it, the same thing, classroom, we have the dates that you were taught, all these ones that are outlined here. We have various conditions that a woman will have to go through, and when they go through these ones and then you are taught, then the tutor signs, you the student also signs. If you are lucky to have demonstration, just as I mentioned, either in the skills lab or in the hospital setting for clinicals, the date that you were demonstrated on those particular ones, you write that particular date, then you also sign as a student and the clinician signs. Then you look for one or two, just as I mentioned. These ones are usually a team. You don't do the procedure. So if you are part of that team and you assisted the officers to do it and then you have fair knowledge on it, you have had that experience, then you will sign, you write that particular date, you sign for it, then your clinician also does the same. So that is how it goes. And if you look at something like this, management of patients with abnormalities, which of the abnormalities they have at least indicated, abnormalities of the vulva, you'll be taught in the classroom. So if in the hospital setting, you know, in the classroom, we might not get a physical patient with problems with the vulva. We would use some of these mannequins to teach. But when you get to the skills lab, the mannequins will be used. You can sign for demonstration. Then you will look for a period to sign for competency. When you get to the ward or the hospital setting, a patient comes with such, then you'll be able to, if you're in charge or your senior goes to do those things, does the management, also make sure you join the team and you try your hands on some of these ones, and then you are able to sign for the competency. That is what it is. So we'll be continuing to see how the next one also looks like. Yes, our next one we'll also be looking at is the SIL and gynecological nursing, and then you see some of these experience areas that you are supposed to consider. Patients who come with problems within some of these organs, management of patients with abnormalities of menstruation, and you see amenorrhea, dysmenorrhea, and the likes. All these ones, just as it is, you'll be taught in the classroom, you will sign, the tutor also signs, then you have demonstration. And with some of these things, you might not experience them in the school skills lab, but definitely as you go for clinicals, you'll be experiencing some of these things. So you experience them, the dates that you went through the demonstration, you write that particular date, you sign as a student, and the clinician signs. Then if you are able to also have an experience, that's for your competency. Can you manage a patient with amenorrhea? Yes or no? With the aid of your demonstration that you have had, and you have tested your hands on it, you trust you can do it. So the day you are able to also comfortably do it, you write that particular date and then you sign for it and the clinician signs. Always make sure, I want to emphasize something here, make sure you try your hands on it. Always try to learn. And as a student, you are not supposed to have a free period within your clinical period. So all the time you make yourself busy. So even when there is no work, you try to look through your clinical schedule book. Some of these things, amenorrhea for instance, patients might be there with amenorrhea problems, but because they have nursed them and they are becoming stable or they are stable, the nurses will not find it important to teach you. But when you ask about it, they can refer to that particular patient, teach you, and maybe the next one that comes, you'll be able to go into it. You know, we have the intermenstrual bleeding and then we have the postmenstrual menopausal bleeding. So you definitely have patients that will come through this, and you can sign for the competency. That is, you write the dates, you sign as a student, then the clinician also signs. So let's look at the next one after.
Something like this. thumbnail and okay, so check our information. So when how to fill in your
how to complete. Okay, how to fill and complete the clinical setting. Okay, more into bracket green book. Maybe like our students, but.
So Balaman,
Picture here. Chat to Juman
send it. Yeah, hello.
Yeah, so I was just thinking.
Yes.
Because if you have a car and it's broken down,
Yes.
I think the issue will be to
Work on it.
get money to repair it. Exactly.
Yes.
And we also actually wanted to rent. That's why I was linking up. Is that not an opportunity to get something to repair the car?
Yes, but the thing is, we can't give it to you in the condition that it is in. Like we can't write it to you in that particular condition, because we have to just work on it first before. And then it's not like some small problem or this thing. We have to change so many other parts and then even the windscreen, for instance, we have to change it and all those things. So that's why. Oh, if it was some minor this thing there, that one be you said within while you could have just gone and come.
Exactly.
So it has to do with the rain. There are so many things that we have to work on. Oh, okay. Okay. I never bought a lot of things, so I'm bored. Was you going to go Monday? Or maybe I said about a lot of problems. I got to cause a mile and send each other. I will run a hospital, the man was young one ban. So,
one another. Okay, so we are back, and as you can see, the next one is the thoracic nursing, and under thoracic nursing too, these are some of the areas Nursing and Midwifery Council expects you to have experience on, and you can see insertion of intracostal drain and the likes. So all these ones that are there, we have the lobectomy and others. So with these ones, you are also expected to be taught in the classroom. Then if you are taught the dates that you were taught, you write those dates. And as I mentioned, if all of these here are taught in one day, you will write the date across, you will sign across as a student, then the tutor also signs across. But if there are a number of them that were taught, per those ones that were taught, those are the ones you write the date to cover. Then if you also had the experience for demonstration, you also write the dates for the demonstration, you sign as a student, then your clinician or your tutor signs. That is the one who did the demonstration for you. Sometimes a tutor can do the demonstration, but will recommend that you should go to so and so clinician to sign. They can have those communication because we are all nurses and we are under the same profession. Okay, so the same thing applies to that of the competency. If you have had an experience to do it and tested your competency that you can do it comfortably, you also write the dates that you had that experience and you were able to do it comfortably. Then you sign as a student, and then the clinician also signs. So let's look at the second one that is under thoracic nursing. You also have some of these ones, and at least we have patients that you'll be managing who are undergoing under water seal drainage. So you'll be taught in the classroom, then you'll be demonstrated to in the skills lab or in the hospital, and then if you are able to also experience a patient like that, and then you also did it, either you even did it with a team, but at least you have enough knowledge about it as to how to go by it. You can sign for the dates, then you sign and make sure the clinician also signs for you. So this is what we have for thoracic nursing, and we'll be looking at what is Okay, so after thoracic nursing, we'll be seeing traditional medicine, gerontology, and home nursing. So these ones will also be taught in the classroom. Care of the hair. These are actually for elderly people. And elderly people, we all know they are vulnerable. Things begin to deteriorate within their system as they age. So some people tend not to even know how to bath or keep themselves well. So you'll be learning all these things under them. And just as I mentioned in the previous ones, the dates that you were taught all these things, you write, then you sign for that, and make sure your tutor also signs. So if you go to the ward and you have demonstrations in the ward, you can write the dates, then you also sign, and then the clinician signs. But if your tutor is able to demonstrate it for you in the skills lab, the date the demonstration was also done, you write those particular dates for each of them, then you also sign for them, and your tutor also signs. So just as I mentioned, in the column 2, it is meant for a tutor or a clinician, any of them. But make sure both doesn't sign for one thing. One of them should sign for one thing, even if both takes you through that particular thing, okay? Then you go to that of column 3, which is the competency. You also make sure you sign for those ones you have been able to do without any difficulties, and then you have enough or in-depth knowledge on doing them. You write the dates for it, then you sign as a student. You make sure the clinician also signs. So that is what we have, and then we'll be seeing what is also up. Yes, so the next one we have is management and administration in nursing, which is termed as governance. In nursing, we term it as governance. So you would imagine whatever that is here. And usually these ones are for the nurse managers or the ward in charges or the principal nursing officers, those people that are leading the various teams or the various ladder of organization. This one is for them. But under nursing, we know our DDNS, that's the Deputy Director for Nursing Services or the Chief Nurse. They are the ones that do the management, but it trickles down to the ward in charges, or even at a point, a particular period, that is either the morning shift, the afternoon shift, or the night, there must be a leader. So at that time, all of us are supposed to have some knowledge about it, and that is how come we are learning all this. So under it, we have human resource, we have material resource, and a whole lot of them, up to planning and then participating in ward conferences. All these ones will be taught in the classroom. So just as it is, when you are taught in the classroom, the dates that each of them were taught, you write the date, then you make sure you sign correspondingly, then you also make sure the tutor also signs. And the same thing applies to the demonstration. So you might not get this one demonstrated in the skills lab in some schools, but at least if you get to the ward and then they ask you to go and take part in ward conference, or even in your ward you sit for a meeting, some of these things, educating and supervising, you might get some of these things in the ward, and usually we get them in the ward. So the day that you studied all those ones, or you observed how it is done, you write the date for it, then you will sign, and then the clinician also signs for that particular one. Then you do the same for that of the competency. If it is comfortable and then you now understand it well, you write the date, then you sign as a student, and then the clinician also signs. So that is what we have for management and administration in nursing. Let's look at what is next. So now I'm brushing up to it.
Check out the last one.
So the next one is public health nursing, and as it has been mentioned, you would find areas where you will be taught in the classroom. So the same way you write the date for classroom, you sign as a student, then the tutor also signs. So if you get a demonstration either in the skills lab or in the hospital, you also write that particular date, you sign as a student, and then the clinician also does the same. Then you do the same thing for that of the competency. And as I mentioned, it is not a must that you should do competency for all of them, but make sure you get 80% and above. So that is what we also have for public health nursing, and the trend follows the previous ones. So if you understand clearly, this is the same thing that you are supposed to do. So let's look at the next one. Yeah, so the next one will be seeing obstetric nursing. And obstetric nursing, these are the experience Nursing and Midwifery Council expects you to go through. And the same way you'll be taught in the classroom, so you write the dates under the dates column, then you sign as a student nurse correspondingly, and then you also make sure the tutor signs. Then you do the same thing for the skills lab acquisition, or when it is done in the hospital setting. The dates you also write, then you sign as a nurse, as a student nurse, then the clinician also does the same. Then you do the same thing for that of the competency. So you sign for a particular one, you write his date and sign for it, then the clinician will also sign. So that is how it goes. And then you imagine that we have given antenatal care, you also have investigations, then you have educating clients on, you have nutrition and the likes. So in your clinical schedule book, you have a whole lot of things that you are supposed to go through, and that is what we expect you to do. Okay, so let's look at the next one. Okay, so after obstetric nursing, the next one in your clinical schedule book is going to be psychiatric or mental health nursing. And the same way, all these areas that the council expects you to have experience on, you'll be taught in the classroom. So when you are taught in the classroom, you write the date, then you sign as a student, and then your tutor signs. So in this sense, some schools will take you to places where they have psychiatric homes. So when they take you there and they do the demonstration, you write the date for that particular demonstration, you sign as a student, then the tutor signs. But if they hand you over to clinicians there and they take you through the process, the clinicians will be the ones signing. Then when you also have the opportunity to test your hands and then you understand the process of it, then you are able to do it. And when you do it very well, you also sign for the date and the competency, then you append your signature, and the clinician also signs. So you make sure each column 1, 2 and 3, each of them has dates, and then signature for the nursing students, and then you also have signature for the tutor, the clinician, or the tutor and clinician. So you make sure each of them is also signed like that. So let's see what is next after. Okay, you can rotate now. Yes, now after psychiatric nursing, that will be the end of all the experience areas Nursing and Midwifery Council will expect you to go through for the period of your 3 years of study. But meanwhile, during the period of study, you'll be visiting places for educational purposes. The school can take you to special areas like the School of the Deaf and Dumb. They can take you to School of the Blind. They can take you to water processing areas. They can take you to waste management and waste processing areas. So all these areas that you will go for educational visits as an institution, you indicate serial number here. It means you write there 1. If that's the first one, you write 1. Then the date that you went for that visit. So usually if you spent more than a day there, you write, let's say today is 25th January 2025, you write 25th January 2025 to, then you indicate the period that you would end for that particular visit. Then which institution is this? Ghana Water and Sewage Corporation. You write there. That is just an example. Then the remarks here is from the supervisor of that institution you went to. So Ghana Water, the manager or any person that is authorized to put there the remarks, the person will remark there. They can write good, they can write satisfactory, they can write excellent, hardworking, anything. But make sure you conduct yourself well during that time so that they don't write bad remarks for you. Because if the remark here is very bad, it will go against you in sitting for the licensing exam. Then the supervisor will append his or her signature and name also here. So on this page, you can have more than 1 educational visits to go. You can even fill this whole thing. So I would advise that if you realize this whole thing is getting full and you still have some educational visits to go in for, just make a photocopy of this particular page. Then you fix it to have enough pages so that you will not be finding yourself in situations where you have to squeeze or not write any of them. These educational visits too, if you think as an individual you would have to visit a place to learn, and then that facility would not expect you to bring a cover letter or an introductory letter. When you go, you can add it. But if the institution demands you to bring that and you contact the school and the school is able to give you such a letter, you can also add that experience, and then it also gets you more marks. The next one after this is list of attachment areas. This one talks about the facilities that you went for your clinicals. So where did you do your clinical attachment? Let's say the first one you did it at the one municipal hospital, so you write 1, then the date, from what time to what time, then you write. So if you are starting today, 25th January 2025, you write the date there. When are you finishing? It is supposed to be in 3 weeks, but this is usually done at the end of your experience, so that you'll be able to write the start date and then you know the end date. Somebody might start and will not be able to finish. That is why we usually advise that you indicate the dates during the end of the period. So you also write again one municipal hospital, you write it there, then they will write the remarks, and then the one that is authorized to supervise you will write his or her name and then her signature. That is what happens here. So within the entire 3 years, all the places you have visited to do your clinical attachment, those places should be lined here. So you can have 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. It could also be one particular facility that you have done that, but we usually don't advise that a student for 3 years you should use only one facility for your entire experience. At least there should be diversity. You change and then have experience from other places to see how things are, because when you complete and you are posted, you wouldn't even know where you are posted to. So you might be posted to a place that you have not had the experience of. But if you are able to combine a number of facilities with how they look, and even if you are posted to a place that is a bit different, that you can bring the knowledge and the experience together to be able to fit into that new place you have been posted to. So that is it that we have here. Now, after this, there is one last page that we'll be looking at, and then we'll call it a day for this experience or tutorial to completing your clinical schedule book for your nursing training practice. So let's look at the last aspect of it. Yes, so the last one that we are going to see will be register of attendance. Now, this register of attendance is very similar to the list of attachment areas. They are very similar. But the difference in here is that if you go to, let's say, one municipal hospital for your clinical attachment and they schedule you to medical ward. Now, serial number 1 here, you write there 1. The date, when were you sent to medical ward, you indicate that particular date. And in medical ward too, they will draw a schedule for you, is that not it? So when they draw that schedule, if you are to be there for 1 week, each day you would have a schedule. Either you go for morning shift, afternoon, or any of them, depending on how the schedule is drawn. So you indicate that particular day, your first day of attendance per your schedule. So if it is today, 25th January 2025, you write it here. Then the time you reported to work. So that is for the time in. So students and nurses were expected to be at work latest by 7:30. So if you got there 6:15, you can write that time. If you got there 7 o'clock, you can write the time. And then if you got there 7:30, you write the time. So the time in. Then after the whole ward experience, the ward, what did you do in the ward? So you indicate that particular ward. Medical ward, how many hours did you make in medical ward? You know, when you go for morning shift, we go 8 and we close 2. So within 8 to 2, how many hours are in there? So you calculate the hours and you write 7 hours, 8 hours, 9 hours, depending on the hours you spent in that ward. Then per the time you closed, you know, I indicated earlier that time in is the time you report. So the time you close, you write it. How many hours interval does it make between the time in and time out? You write the hours. Then the in charge will give remarks. Then the trainer will write will put her name and signature, and then you, the student, will also do that. So this one is unfortunate. The RGN has only just a number of pages. They are not enough. So I will entreat RGNs, make a photocopy of this entire page, several of them, attach them to your clinical schedule book. Because if you are going for to the medical ward for, let's say, 2 weeks, surgical ward 2 weeks, and you are going to write for each day, you can imagine this whole thing will be full. So you need to get quite a number of them, make photocopies and attach them, so that you go through the process again, just as it is. So when you change to a surgical ward after this, let's say the next page, you also indicate the serial number it follows, the date, the time in, that is the time you report to work, the time you have closed from the ward, which ward did you go, surgical ward, obstetric, maternity, or you can go to casualty or pediatric ward, the hours in between, the time in and time out, then the remarks again from the in charge. The trainer will write her name and his or her name and signature, then you, the student, to do the same. So that is what is done in the clinical schedule book, and that is your experience that we expect every student to do. If you comfortably do all these things, and then you are scheduled or prepared to write your licensing exam, as soon as the officers come to go through this book and you meet the requirements, you will be permitted to do your exam, and I wish you will be able to pass and pass well, because you have attained a lot of experience. So this is how we'll end today's session. Hopefully I'll prepare, and then we'll be able to get other sessions when the need be. Subscribe to our YouTube page as it is, and then you'll be able to get more of such deliveries as and when we post any of them. You can even click on the notification, so that when you are online and then we upload any of the videos, you get a notification and you'll be the first person to also view and have a knowledge of these videos that we'll be posting there. See you another time.